Well, now that Thanksgiving is behind us and cold weather is setting in, it's more important than ever to get some regular exercise.
And 4 recent studies have shown that various types of exercise can dramatically reduce your risk of getting Alzheimer's disease. Dr. Zorba Paster joins us from his clinic in Oregon. Hi, Zorba.
Hello, Zorba.
Hi.
So we've always known that exercise is good for us. What's new here?
Well, I think what's new here was they looked at the gray matter in the brain. And the brain, as we get older, our brains shrink. Doesn't mean we're actually losing intelligence. It's just one of the things that happens in our brains. But they looked at the gray matter of patients who exercised and have discovered that the patients who exercised did not have as much of a reduction in gray matter as the people who did not exercise. Now, that combined with another study that seemed to show that exercise improved well-being and also seemed to improve memory really leads us to believe that regular exercise may help reduce the risk of developing Alzheimer's. Doesn't mean you won't get it, but just like wearing your seatbelt reduces the risk you're going to be in a fatal car crash, exercise appears to be more important than ever.
Any specific exercises or anything?
No, they looked at overall exercise. When we look at exercise for people who are mature adults, we found that it should be balance, should be aerobic, and it should be strength. So when it comes to exercise, you want to do something such as yoga so that you're not as likely to fall. You may want to do something aerobic that's good for your heart. And strengthening exercises have also been important. But not one of them is better than the other. It's just doing something, getting off of our butt, if you will, our derriere, and moving.
Well, another recent study showed, though, that the more you exercise, speaking of mature adults, the more you can hurt your knees. So what are some better exercises than others?
Right. This particular study looked at exercise and cartilage and discovered that older adults, when they start to run and jog, tend to reduce the cartilage in their knees, which we know is bad. So what you want to try is an exercise that is not too rough on your knees, something that is not as jogging. That would mean swimming. It's hard to swim sometimes in the middle of the summer or in the middle of the winter because you've got to find a place. But the elliptical, I think, is a great place to start. Or on the treadmill, where you take the treadmill and you put it up so that you're actually working almost going up a hill. Far better than jogging, far better because you don't jog your knees and you're not as likely to be injuring your cartilage.
Yeah, somebody with bad knees and a certain age. I find the reticulated bike works pretty well, too.
No, absolutely, it's the bike. The idea is, when we're younger, we can bounce and move all that we want to, but when we get older, we just don't have that same cartilage. So yeah, a bike, anything that is not traumatic to the knees is something I would recommend, certainly for anybody over the age of maybe 45 or 50, or anyone has the beginning of osteoarthritis.
Just another good reason to exercise.